Has anyone ever told you you're a hypochondriac? Today we're going to talk about the word hypochondria and hypochondriac. What do we know of that word? We think of it as someone who exaggerates, right? Someone who thinks that they're sick all the time, but there's nothing there. Well, today we're going to break down that word hypochondria and hypochondriac. And we're going to give you a little validation, which is what I love about this medicine is that you're not crazy. We're going to validate your feelings and your experience, and you may not be the hypochondriac that maybe some people think you are. I love that this medicine, East Asian medicine that is, will sometimes literally connect the dots. And I love saying that because it is about acupuncture and meridians and points and channels that literally connect the dots and relate them to parts of the body as well as organ systems and treat you accordingly. It literally connects the dots, not only physically, but metaphorically speaking. And the word hypochondriac is one of those things. So let's break down the word hypochondriac. When you talk about medicine, you have a whole different language. And the word hypo is a prefix that means under, and chondra, which means rib. So hypochondriac is something that relates to the area below the ribs. So in East Asian medicine, hypochondriac pain is actually a very valid thing, and it relates to a pattern that connects to the liver channel. And as we know, the liver channel relates to not only the liver itself, actually, but also there's an emotional component that affects the liver channel. So what I love about this hypochondriac pain is that when we have that, it relates to our liver channel, and we know that there is usually some sort of emotional constraint, some sort of stress that is overacting onto the muscular nature or the organ systems, the body, that causes this discomfort and pain below the rib cage. So now, if you want to be severe with that, it actually does relate to the liver as well, directly, because if you have fatty liver, you will have pain below your rib cage on the right side. Because the fatty liver causes this inflammation in the liver, it will grow, it'll expand, it'll fall below the rib cage, which it normally doesn't, and it will be uncomfortable. But most people aren't at that level. That's what I love about this medicine is that it catches things before you get to that level. So the minor part of the liver stress, the stress that affects our bodies, it affects our cortisol, it affects these fats in our body that does cause distress to the liver. It might not show up on your liver panels, and it won't show up on your ultrasounds because it's not that severe yet. But it is a valid thing, and it really does happen, and you are experiencing. So when we're stressed out and emotional, if you palpate or feel around your rib cage or right below the rib cage or right kind of on the medial or the inside aspect right between where the ribs come together, these are really emotional points. These are trigger points that are telling you that you are feeling stressed. When people talk about stress, they'll feel anxiety, they feel tightness in the chest. The muscles around the rib cages, the intercostal muscles, they contract, they get tight in that fight or flight situation, just like your trapezius muscle would. And you feel that, and you feel the tightness, and it feels painful right underneath the ribs. So if you're experiencing this, it will feel uncomfortable. And you might go to your medical doctor and they will say, we'll run your panels. They'll look at your ALT, your AST, your enzymes, your liver enzymes. They will palpate. They will even maybe, I doubt this, but they may run an ultrasound if you have history of something with your liver, but they're not going to see anything. And the irony here is that you would be considered a hypochondriac, right? Because according to them, There's nothing wrong with you. So I don't know this for sure, but I always kind of wondered, is that where this came from? Like years of people feeling discomfort and stress and pain that's underneath the rib cages, and they go and get it looked at, and nothing shows on the labs or in the imaging, and they think, it's hypochondria. You're a hypochondriac. Why else would you have this experience? Why else would they say that? And you're, as we often do, get sort of pushed aside that there's nothing wrong. But there is something wrong. One thing I really do appreciate about this medicine is you're not crazy. People come to me and they say, this is probably nothing but, and they tell me, and I say, please do. Please tell me, because what you're feeling and experiencing matters. And you might not realize it, but it may have a relationship to a channel or a point that means something. It means something to us. We can actually look at it and say, that actually tells me something. That's telling me that something is a little bit out of alignment. This is the one thing I really love about it, is that you can come to me and you can tell me where it feels uncomfortable. And that might relate to a point or a channel that is telling me not only something that is physical that may be out of alignment, but it could be emotional or it could be metabolic. But those original feelings are what we want to address so that it doesn't show up on your blood work and it doesn't show up on your ultrasound. If it's gotten to that point, we're too far. We're too far down the path that we want to be. Can we still treat it? Yes, we can. It's going to be more of an intense treatment, and it's going to take a little longer to resolve it. So that's why it's so important to come in and we can talk about these little red flags, these little lights, these little hints our bodies give us that there's discomfort. And so right underneath the rib cage there is a perfect example. I palpate here and people go, oh, that's uncomfortable. I never realized that. And I say, yeah, we're going to handle that now. We're going to open this up now. We're going to relax those muscles around the rib cages when they are relaxed, obviously open up the chest and give you some relief. But there's an emotional component. And then when those muscles are released and the blood flow is increased, that also relates to the organ system itself. So we are nipping it in the bud. We are catching it before it's a problem. And more so, you are not a hypochondriac. You are indeed having hypochondriac pain. You are indeed having discomfort below your rib cage. And we will treat, and then you will not have, in what we're hoping will have any long-term issues with those channels and those organ systems. So, just an interesting little quip about the word hypochondriac and about hypochondriac pain, which again is not nothing, it is something, and we're here to treat it.
The information provided in this podcast is for educational and informational purposes only, and it is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.